This patient came to us with severe aortic stenosis. The valve in one of the left side of the heart was stenosed, and because of this the heart had failed. She had recurrent heart failure. Multiple times she had admissions to the hospital where she needed a treatment with intravenous drugs and injections to bring her out of the heart failure. In spite of giving treatment, best medical treatment for this refractory heart failure, or let us say end stage heart disease, the heart pumping action was very weak and we could not improve it further. In this situation, what we planned was to do a balloon aortic valvuloplasty, which is a standard procedure for any patient with severe aortic stenosis. In spite of doing a balloon aortic valvuloplasty and having some improvement in the cardiac condition, the patient's condition remained the same. And for her, we had to intubate her and ventilate her for about almost a week. In spite of being on ventilator for 1 week, there was not much of an improvement in her condition, and we had to think of other options what were available for improving her general condition. Fortunately, we have Dr. Gokhale and team who had experience in this field, who had done previous cardiac transplants, and we thought probably we should offer her something more than the routine medical care, the best medical care which could not bring the patient out. In this situation, we suggested to the family that we can think of doing an aortic valve replacement, which is a standard surgery again in this situation, but in the prevailing heart failure, ongoing heart failure, it was a very high risk procedure. So in this situation, we thought probably implanting a left ventricular assist device, which is a device to help the heart recover its function, which is depressed because of the severe obstruction because of the aortic valve stenosis. Now, once the obstruction is relieved with an artificial valve, the heart muscle still takes time to recover. For this recovery, it may take about a week, 2 weeks, or 3 weeks, or 1 month. So for this recovery of the heart, we have put an extra assist device to assist the heart in pumping the blood so that the heart takes rest for improving its function. And with this, we will be able to recover the heart muscle function, and hopefully the heart will start pumping more efficiently. And definitely there has been improvement. The heart function before the surgery was about 15 to 20% ejection fraction. Now it has improved up to 30 to 35% ejection fraction. The blood pressure is much better. We have been able to take her out of the ventilator. The need for drugs to improve the blood pressure, to maintain the blood pressure, also has decreased drastically, and she is on the road to recovery. We pray that she does well and improves and goes home comfortably. No, the other conditions, bronchial asthma, hypertension, diabetes, are routine managed care. It doesn't need much of critical care management, except for this cardiac status, which was very, very critical. It was an end stage disease where we could not offer her much more than medical therapy, and we have even the balloon aortic valvuloplasty which we had done was not bringing her out of the present condition, and she was dependent on intravenous drugs, dependent on the ventilator. Nothing more could be done for her other than the maximum medical therapy what we have given. In that situation, we had to do this heart surgery, valve replacement with the help of an left ventricular assist device. No, this is not a heart attack. It is the muscle of the heart. It is the heart muscle which has gone weak because of the obstruction. So once you relieve the obstruction, the heart muscle will recover. Now to help in recovery of the heart muscle and to improve the blood pressure and perfusion to the organs, the blood supply to the other systems of the body have to be improved. For that reason, the left ventricular assist device has been given. Now, this technology has been available abroad for many years, but the technology is available to us at a higher cost. Now, a lot of patients who have severe heart disease, severe heart failure, who are not suitable, who are not getting more advantage with medical therapy, who have used the maximum medical therapy and still having maximum symptoms where they are not able to do the routine activities of life like washing themselves, having a bath, changing clothes. In that situation with severe heart failure, this left ventricular assist device will help them to bridge their recovery time so that they can recover faster and smoother.